Thank you so much, sir. It was undoubtedly very, very informative for all of us. I would now like to call upon Dr. N. Junior Sudresh. He is an experienced doctor with a demonstrated history of working in the hospital and healthcare industry, skilled in laparoscopic surgery, gastroenterology, hernia repair, and breast surgery. He is going to speak on AI-assisted surgery, the future of minimal invasive procedure.
Very good afternoon, everybody. This topic is AI-assisted surgery, future of minimal invasive surgery. From the land of cosmic dancer, introduction to robotic-assisted minimally invasive surgery. Excuse me. 1 minute. I want full screen. Okay. So this is next line. So minimally invasive surgery and robotic integration. MIS typically involves multiple small incision for long handled manipulators and an endoscope. Benefits: reduced scarring, less trauma, and faster recovery. Challenges: loss of wrist motion, fulcrum effect, and limited hand-eye coordination. Robotic technologies address this by offering articulated tools, enhanced imaging, haptic feedback to improve dexterity and force perception. So, robotic surgical system classification. The surgical robots can be categorized by interaction mode, autonomous versus master slave control. 2. Clinical application for specific surgery, for example, thoracic and orthopedic. 3. Role in surgery, various from performing tasks to assisting with precision and stabilization. So, introduction to CAD and CAM and assistive systems. So, it is computer-aided design and computer-aided manufacturing. Refers to the use of computer systems to design surgical procedures and manufacture tools of precise execution. Assistive systems, robotic systems that aid in executing preoperative plans with high precision, ensuring optimal outcomes. So applications particularly relevant in orthopedic and neurosurgery where precision is critical. So robotic system in CAD and CAM for surgery, neurosurgery, one of the earliest robotic system for neurosurgery, used for stereotactic brain biopsy under CT scanner supervision, autonomous execution with 5-DoF robotic arm. Neuromet neurosurgery, developed precise tool positioning in brain surgeries, FDA approved and used over 1,000 clinical cases. It offers both 2D and 3D images registration. So notable robotic system in MIS, CyberKnife is used, robotic surgery used in both intracranial and spinal procedures. Spine assist, robodoc, autonomous robot used for high precision bone cutting, particularly hip replacement surgery. Orthorobot, robot urology, it is used in the urological prostatectomy surgeries. This is CyberKnife, spine assist. So endoscopic camera holders and robotics. So endoscopic camera holder ASOP, automatic endoscopic system. Precise voice control or sensor control endoscopic positioning, enhanced robotic arm to give better control over the field of view during the surgery. The role of AI in enhancing CAD-CAM system, precision efficiency. AI enhances CAD-CAM systems by optimizing pre-operative planning and adapting during surgery. Real-time adjustments can be made based on AI-powered analytics. Improved imaging, AI algorithm can improve image registration, ensuring that the robotic system follows the optimal pathway during surgery. The master-slave robotic system is a surgery involved in a surgeon controlling a robotic arm that minimizes hand movements for precision tasks. Components: master console, the interface of the surgeon, often involving ergonomic controls and 3D visualization. Slave cart, the robotic arm are positioned near the patient, performing the surgery based on the surgeon's command. Examples of master slave system: Da Vinci surgical system, geosurgical system. Other advanced robotic systems, NeuroRobot, it focuses microscale neurosurgery, removing small tumors in atypical meningioma, features micromanipulator with 1 mm forceps. Number 2, neuro arm features MR compatible 7 DFS force and tactile feedback. 3, Raven features dual master controls for remote operations validation used for tele-surgical tasks. Neuro robot. AI enhanced master slave system, real-time decision making. AI can provide surgeons with insights such as risk assessment during surgery, personalized surgery. AI can analyze patient data and to customize surgical approaches, learning and adaptations. With the machine learning, robotic system can improve their performance over time by adapting to the surgeon's movements and preferences. Introduction to mechatronically enhanced surgical tools enhance the surgeon's abilities with integrated intelligence, autonomy, and the improvement of tactile or haptic feedback during surgery. Types of handheld surgical tools. Mechatronic handheld tools, surgical instrument designed to enhance manual operations through automation, control, and sensing capabilities. Features increase accuracy, tremor compensation, real-time feedback on tissue contact, autonomous motion adjustment. Examples of mechatronic handheld tools: collision avoided endoscopy for arthroscopy. Key features: semi-automatic collision avoidance to prevent critical area contact during surgery. Active tremor compensating microsurgical tool. Technology such as piezoelectric actuators to the cancel tremors. Addition of visual surveying to enhance surgical precision. 3, steady hand eye robotic for retinal microsurgery. It functions as cooperative control system, allows for high precision retinal surgery. Its main advantage is eliminate tremors and provide additional stability during the delicate procedures. Advantage of mechatronic surgical tools: enhanced precision and accuracy, tremor compensation, real-time sensory feedback. Semi-autonomous robotic tools. These tools that integrate a level of autonomy in motion, assisting the surgeon in specific tasks while still under their control. For example, the Sensei robotic navigation system. It functions control a steerable catheter and fluoroscope guidance. It features a real-time 3D tracking and catheter to tissue contact feedback. Advanced semi-autonomous system for endoscopy surgery. 1, Heartlander, application cardiac surgery. It mainly functions as a miniature mobile robot for cardiac MIS cable of in-crown worm-like locomotion using suction pads for addition. Number 2, cardio ARM, functionally highly flexible robotic probe for epicardial interventions. Its main key features is alternating rigidity of concentric tubes for minimal tissue interaction during procedures. So, robotic endoscopy system for gastrointestinal surgery. Endoscopic capsules, initially passive devices, now evolving with the active locomotion through external magnetic field or onboard actuation. For example, legged capsule prototypes. Functionality: actuated by 6 legs for forward motion in the GI tract. It key features smooth navigation, minimal tissue damage during colonoscopy. The features of mechatronic and robotic storage role: integration with AI, miniaturing and wireless control, full autonomy. Preceptual docking and synergetic control in robotic surgery. Its main goal is seamless control sharing between the surgeons and the robot. What are the system involved? It is Acrobat Sculptor, Mac Oreo, and PADC. It benefits mostly enhances safety, precision, and customization in surgery. For example, application is orthopedic surgery with pre-operatively defined regions. Preceptual docking concept. It focuses on combining human procedural behavior and motor control via real-time sensing. Technology used in eye tracking to enhance gas contingence control, 3D tissue deformation recovery. Framework used for multiple robots in procedures like gastric cavity surgery. Virtual fixtures in robotic surgery. Concept: haptic feedback, periceptual overlays for more precise robotic control. Types: forbidden region, guidance area. Applications: microsurgery, cardiac surgery, and nasal sinus cavity navigation. Example of VF applications is microsurgery, enhances dexterity in delegate operating. Example: retinal vein canalization. Endoscopic surgery, constrained motion for better navigation is confined anatomical spaces. In cardiac surgery, using dynamic VF to adapt to heart surface deformation in real time. AI in peripheral docking and synergetic control in robotic surgery. Advanced peripheral docking, AI-powered machine learning algorithm could improve eye tracking and conjunctive load management, allowing robots to understand and anticipate the surgeon's action, adjusting the system behavior in real time. AI could further enhance adaptive virtual fixation system, dynamically adjusting haptic feedback based on the patient's real-time responses. Example: tissue deformation. Predictive AI models can forecast potential risk, adjusting VF guidance to prevent complication before the rise. Dynamic active constraint in robotic surgery. Active constraint concept enhances safety by gradually increasing haptic stiffness as the tool approaches a predefined forbidden region. Application primarily in orthopedic surgery but expanding to more complex tissue deformation. For example, cardiac surgery. The most advantages is improve surgeon's precision and efficiency by limiting the robot's motion and enhancing hand-eye coordination. Real-time dynamic modeling of active constraint. Framework allows robotic tools to adapt the real-time tissue deformation and anatomical changes. For example, cardiac surgery, innovation use of 3D coordinates, smoothened constraint pathways and proximity queries to ensure safe operation. Dynamic active constraint control, path following. Robots follow a predefined constraint pathway based on a 3D tessellation model. Optimization for tissue deformation. The robot's movement adapts to rapid tissue deformation, ensuring safe and accurate procedures. Parallel computing, use of advanced computing platforms. Implication of AI for the future. Number one, enhance dynamic constraint with AI, predict tissue deformation and optimize constraint, robotic autonomy, AI-powered real-time path. The path following algorithm learn optimal motion patterns. 3, gaze contingent control with AI integration, AI-driven eye tracking, surgeon's intention. Advancements in surgical autonomy, robotic system could autonomically adjust constraint, predictive AI model for complex procedures. So my conclusion is short-term versus long-term impact. We often overestimate the short-term effects of technology and underestimate the long-term effects. Robotic surgery true potential may not be fully realized yet, and the current ethical concerns should be carefully considered. Thank you.
So just a quick message for the AI. You know, we loving the AI. AI has been everywhere, but I personally think that AI is a threat to humanity. And going back, because AI has taken over the brain of the human beings completely. Nowadays, AI does everything. Like AI writes the notes, AI writes the chart, AI writes going to paper, AI is, taking over the surgical aspect. There was in France recently, they were trying to incorporate AI into robot. So they given 3 tasks to the robot to perform. And after feeding all our robotic surgeons, data into that machine, and when the machine was doing, the AI was doing the task, they did like 5 different tasks. They showed only 3 tasks, but the AI did 5 tasks. So the scientist was watching this one. He was completely amazed how I taught 3 tasks, and this freaking machine was doing 5 tasks. So it's a very, very scary situation, especially for the younger generation. And as Microsoft, Bill Gates said that only 2 jobs will be left over. One job is luckily the medical care which we're performing. Second is the manual job. And the third is job which is incorporated with the AI. So all other jobs will be completely taken over by the AI, because right now I'm being the chief of bariatric. And I love these things, AI, because my English, coming from India, is not as good as the American English. So when I write emails, I use AI, and immediately the nice emails and letters, it just generates pretty fast. But I personally think they're taking away the brain of the kids away, because nowadays all the kids use ChatGPT and all these different tools to succeed in the exam. And recently the AI basically asked to take the USMLE exam, for going to in America. So the score by the AI was like 100%. It's completely. So that's a very scary situation, and I don't know where we are heading towards. In fact, one of the Indian, he was working with a ChatGPT, and he just found to be had a suicide, but it's doubtful whether it was suicide or whether he was killed. So it's a $1 billion industry, is a threat to humanity. I personally think like that. and I don't know where we are going in future.
I think whenever any new technology comes, there are obviously challenges and concerns, and similarly that's what is happening in AI. But I think people who will use AI will survive to keep their job. People who are not going to use AI will obviously not have a job. But yes, as you rightly said, we need to have checks and balances with any new technology which can threaten humanity.
Actually, the AI is going to make songs. They already make poems nowadays. So you might not be any singer left over in the future. That's another story.
Thank you.
Don't worry, they will be there. Our Kishore Kumar, Mohammad Rafi, nobody can take away their jobs. Thank you so much.
Thank you.
Thank you.
Thank you so much, sir, for sharing your knowledge. I would now request all our chairperson, please, to felicitate our respected speakers. Please, speakers, please, sir, please, all of you come on stage. Sir. हो गया